Good afternoon, seniors, teachers. I'm here to present our study which uses generative AI as a chatbot to support patients undergoing cataract surgery. Cataract surgery is the most common surgery performed worldwide, but however, there continues to be apprehension among patients. They are looking for timely, trustworthy information, but they know that it's a challenge to reach out to doctors in person every time. And finding reliable information online is always a challenge. Technology has been used widely in healthcare, from using robotic process automations and administrative tasks to some chatbots that have been used earlier. And OpenAI's ChatGPT has been shown to be able to address both patient queries and also enable professionals access information. So our aim was to see whether we could develop a WhatsApp-based ChatGPT-powered bot that could reduce preoperative apprehension and anxiety in patients and improve their experience. We included those who were coming for cataract surgery for the first time. They had to be literate and had to obviously access WhatsApp about the age of 18. They filled an onboarding form which included them filing out a Likert scale score about what they thought their anxiety was. The bot was built in support with Microsoft Research in India. This used an Azure AI language translator because we realized that most of them would be visually impaired and would want to probably voice record their messages. So this was made available in the 4 common languages, that is 5 languages that's spoken in Bangalore. We used GPT-4 to classify the question. This then went to the doctor or counselor, whether it was medical or logistical. The ChatGPT went through a curated knowledge base which had content that we had uploaded into the system and gave up an answer on an average between 4 to 7 seconds. But the same answer was also pushed to the doctor and counselor, and if they marked the response as correct, it came up with a green tick, and if it was wrong, they made a correction and that got corrected. I'll show you a short video that'll kind of highlight what we had done. These 2 screens show the point of view of the patient and the other one is the point of view of the doctor. So here you see the patient actually type in a question saying that when can I take a shower after surgery? This is a very commonly asked question, and almost instantaneously an answer should pop up on the screen now. Where it says that you can take a shower, you will see a small question mark there that indicates that this was generated by the bot. The doctor gets the answer that the bot has kind of generated, and it also tells them from where the answer has come. Meanwhile, they put yes and the question mark has changed to green, and the bot also triggers the next 3 questions they can ask. We've had as random questions asked as saying that how can I eat biryani or how early I can eat biryani. So we had about 258 users that you asked these questions in a variety of languages. Of them, we found that a large number of questions were actually asked by the attenders, and 85% of them had asked at least one question. This ranged from surgical procedure to medication, pain, and recovery. A majority of the questions did not require an intervention from our side. A lot of them needed only some missing information that needed to be done. And when we looked at the anxiety score before the bot was used, it was about 3.4 that dropped to about 0.32. And on an average, there was about a 1.5 drop in the Likert scale pre to post intervention. So what we've realized is that cataract patients do have an amount of anxiety, although not very high on the Likert scale. And this ranges based on various studies anywhere between 11 to 80%. Information is provided to all these patients by either the doctor or the counselor, but often there is a chance of misinformation being provided by the staff or a misperception, and also studies have shown that there is a limited retention. So with this, we looked at a 2-stage LLM-based bot that could actually provide a verified answer. Even our previous deployments where we've looked at AI, the patient always wanted a human being to tell them what was happening. So this is the first of its kind tired model where the patients and attenders have an advantage of an instant response that does get validated over a period of time. Patients were extremely comfortable because they knew there was a doctor at the other end or a counselor who knew the subject was validating the responses. And with this, over a period of time, as the knowledge base got updated, our intervention also kept coming down. This, of course, has a limitation of being tried only in a condition. We've now expanded it to a couple of other conditions, and we did not, in this particular study, look at why 15% of them did not ask a question. We assumed that they did not have any questions to be asked, and therefore they did not look at it. In conclusion, this is the first possible GPT-4-based chatbot which is able to aid in creating answers to patients' questions by drafting responses that can actually be reviewed by clinicians. It alleviates anxiety and apprehensions and makes the patient journey for cataract surgery much more comfortable. Thank you so much for your time.
Nice study, sir.
Thank you.